In type 2 diabetes, the insulin, which is the chemical or the hormone that is produced by beta cells, are not enough, or if they are enough, they are not working properly. Welcome to DAYSPRING Life and Health. This is Dr. Oting coming to you again on the series on diabetes. Today we want to talk about what actually happens in type 2 diabetes. So in order to understand what actually goes on in type 2 diabetes, what we want to do is we're going to review what is type 2 diabetes, just a quick review, and then we want to define what is insulin, and then we also want to talk about what is glucose, because these two keywords are involved in type 2 diabetes. Before we get started, I want you to hit the subscribe button if you haven't already subscribed to the channel, so that you receive notifications when new videos are uploaded. If you have already subscribed, hit a like or comment. So let's get to it. So the first thing is, let's review what type 2 diabetes is. Type 2 diabetes is a disease in which there is not enough insulin levels. So you could have type 2 diabetes if you're not producing enough insulin, or you produce enough insulin but it is not working properly, it's not effective, or you have a combination of the two things going on. In that case, you are unable to control your blood glucose levels. So that's the second keyword. So what is insulin then? So insulin is a hormone that is produced by the beta cells of your pancreas. So the pancreas have a specialized group of cells called the beta cells, which function to produce insulin, which is basically a chemical or a protein molecule that is released in the body when glucose levels are detected in the blood. So that is just a prelude to what actually happens in type 2 diabetes. And then, with that being said, let's define what is glucose then. Glucose is the basic unit of carbohydrates that are absorbed in the body and into the blood for use by the body. In other words, glucose is the simplest form of your carbs or your carbohydrates that you eat. You eat starchy foods, you eat rice, you eat yams, you eat potatoes. Whatever form of carbohydrate you eat, it goes into the body in the form of glucose. So that is the glucose that we're talking about. And glucose happens also to be the energy form of the body. Think about it, an automobile or a car. When you have a car, you need to fuel your car with gasoline or petrol, as we all know. In the same way, for the body to have energy to work, you need to supply the body with glucose, which is the fuel of the body. Let's talk about what happens in diabetes, in type 2 diabetes then. Now that we know what insulin is and what we know what glucose is, what happens in type 2 diabetes? So why insulin? Insulin is needed so when you eat and the body breaks down your carbohydrates or the food into glucose, which is absorbed into your blood, you need insulin to pick up the glucose and then convert the glucose into the energy that your body actually uses. So if you don't have enough insulin, the glucose that is picked up into your blood remains in the blood and not get picked up into the cells. And when that happens, you have a higher amount of glucose floating in your bloodstream. So that is what happens in type 2 diabetes. When glucose is picked up, that is when glucose is used for normal cell functions such as in muscle contraction and relaxation. If your insulin levels are low or they are not working, the muscles can pick up your glucose and glucose remain high. Glucose levels remain high in the blood, which we call diabetes, type 2 diabetes. In the normal person without diabetes, the glucose levels being high will be picked up by the liver. The liver will pick them up and store them in the form of glycogen, which is released during starvation, or which is released when you are in need of energy and cannot eat or do not have food. The glycogen will be changed back into glucose, which will be picked up by your cells for use. So insulin is needed basically to pick up glucose, which is in the blood, and the glucose is used as a fuel for your cells to work, and also glucose is also stored for future needs when necessary. So in type 2 diabetes, the function of the insulin is hampered, and because of that, glucose levels rise in the blood, leading to symptoms that we call hyperglycemia, or all the other symptoms that we know associated with diabetes. Well, thanks for watching, beloved. I wish above all things that you prosper and be in health, even as your soul prospers.